everyone, I'm Sarah Hornsby and I am your online myofunctional therapist. Today I want to talk a little bit about tonsils and adenoids and how that relates to myofunctional issues. This is something I talk about all the time with the patients that I see, especially people who are having their kids go through myofunctional therapy or get myofunctional evaluations with me. So why do tonsil and adenoids matter? Well, to me, it affects the airway and the breathing. And usually kids with giant tonsils and adenoids breathe through their mouth. So that creates a cascade of problems that I've talked about in several other videos, but just to kind of summarize and recap, if you mouth breathe, it changes the way your face grows and develops, it changes the way your teeth come in, and it changes the size of your airway. So you're more likely to develop sleep issues like snoring and sleep apnea, either presently during childhood or as an adult as those kids get older. So I'm not a big fan of just saying, oh, there's big tonsils and adenoids, let's have surgery. I'm really, my method is, how do we get to the root cause? You know, why are the tonsils and adenoids big in the first place? Usually it's an allergen. It's something that's bothering the immune system. It's creating an inflammation in the body, an inflammatory response. So what can we do, either through food or the environment or something that can help the breathing get better? So this is really tricky, and I think there's a fine line between trying to do natural methods and trying to not have surgery, and getting to the point where kids with really large tonsils and adenoids are having true severe breathing issues, and it's affecting their ability to concentrate in school, get good sleep at night. So I don't like this to go on too long. I think if you can't get the tonsils to shrink naturally over 6 months, I think it's time to have surgery. So I think the best thing to do is try first just changing from mouth breathing to nasal breathing. This is something I do with people all the time. Just changing your breathing can help the tonsils reduce in size. If you want to have an allergy test done, this can help you pinpoint what might be causing that underlying issue. I'd really recommend finding a naturopath or somebody who, I always kind of lean towards going the natural route when it comes to allergies. I feel like naturopaths are really trying to get to the root cause, and some of the immunology tests I feel like aren't quite addressing every possible symptom, but that's just my opinion. So, whether you go to a hospital or whether you go to a naturopath to have that allergy test done, just know that there's multiple options out there when it comes to getting tested for allergies, especially in really young kids. Sometimes I hear that doctors won't do allergy tests on kids like under a certain age. So do your research, find out who's in your area, but just keep in mind, if the tonsils and adenoids are big, there's a reason. Unfortunately, once they get enlarged and inflamed, there's this bad cycle that happens with the symptoms. So it's difficult for kids to breathe through their nose, so they breathe through their mouth. The more they breathe through their mouth, the bigger the tonsil and adenoids become and the more inflamed they become. So stopping this cycle is something that I really try to do with all my patients who have large tonsils and adenoids. The thing is, when you have large tonsils and adenoids in kids, they are likely to have sleep disordered breathing. So a lot of times they can have sleep apnea, even if they're young. I mean, 3, 4, 5, 6-year-olds can have sleep apnea. It's not, it happens in kids more than we think. About 1% of kids, that's 1 in 100 kids, have sleep apnea. I end up seeing a lot higher percent of those kids in my practice, because the symptoms of kids with sleep apnea and kids with myofunctional issues overlap quite a bit. So hopefully this video is informative and helpful for you. Basically, the moral of this story and the moral of this video is, if your kids have large tonsils and adenoids, they probably have myofunctional issues. Actually, I know they do. They're gonna have mouth breathing, they're gonna have breathing issues. If you can get to the root cause of what's going on, that's gonna be your best bet in treating it. If you can't figure it out, if you can't get it to work, have those tonsils and adenoids taken out so that your kids can breathe better and be healthier, and they can get oxygen to their brain and bodies and learn in school and all of these things. So the one thing that I'll leave you with as I wrap up this video is kids who have their tonsils and adenoids taken out don't automatically start breathing through their nose. They can, they have the ability to do it, but oftentimes they don't because that habit is strong. If they've been breathing through their mouth for like 3 years, maybe between the ages of like 4 and 7, they've had tonsil and adenoid issues. That is an ingrained habit and they won't just revert. I hear ENTs and doctors all the time say, oh, once you have the tonsils taken out or the adenoids taken out, the breathing will become normal. I do not see this happening. I work with kids all the time who've been breathing through their mouth for years, and they have the perfect ability to breathe through their nose. The habit is just so strong that they don't do it. So that's why they end up working with me. So I hope this video helps. I hope you have lots of new information and new things to think about when it comes to tonsils and adenoids and mouth breathing in kids. Stay tuned. I'll be making more videos on these topics. You can also leave some comments below. If you have a certain topic you'd like me to cover, let me know and I will talk more about it in one of my next videos.